Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Hello, I'm Susan Cosgrove, and I'm with Dignity Health, Yavapai Regional Medical Group, Ponderosa Pediatrics. Today in our Healthy Conversations, we're going to discuss depression, what it is and what it is not. A little bit about myself. I've been a nurse for over 30 years. The last 15 or so, I've been an advanced practice nurse, which is a psychiatric mental health nurse practitioner. I've worked with pediatrics all the way to geriatrics, but currently I work at Ponderosa Pediatrics, seeing children, adolescents, and even some young adults, working with them as well as their families. So today I hope you'll come away with a little more knowledge about what depression is, what some of the misconceptions and stigma might be around depression, the symptomology, care and treatment for depression, as well as how to support somebody that's struggling with depression, whether it's a child or an adolescent or someone else in your family. So let's start out with a definition. The National Institute of Mental Health has a really good, all-encompassing definition. And if you're looking for some place to get information about any mental health, the National Institute of Mental Health is a great website. You always want to go to websites that have data, research data about mental health issues, and this is really a good one. So this definition is that depression is a common and serious illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is treatable. Depression causes feelings of sadness or a loss of interest in things that you've once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work or school or home or all of the above. So now that we kind of have a working definition, let's talk about what depression is not. So it is not a weakness or laziness. Even young children will come to me, and when I'm doing their evaluations, they'll say things like, well, I'm just lazy. Teens will say this as well. So it isn't that. They're not weak or lazy. And as we looked at the depression definition, we saw what that kind of looks like, and we'll get into that even in more detail. It's not a changeable behavior, something that we can just have them change, right? Well, come on, like buck up, pull yourself up by your bootstraps. You've got this. It's not a behavior that can be changed. It's not a character flaw. There's not something wrong with their character, but so that's often what is seen as what's wrong in depression. And they're not just trying to get attention. People generally that are suffering from depression, they don't want all the attention on them, right? They want to isolate and kind of be alone. And it's not being crazy. And in my profession, we don't use that C word, crazy. All right, so those are things that depression are not, which are some of the stigmas that people have about depression. Now let's talk about some of the symptoms. I think most of us know that depression is often a sad or depressed mood, feeling down, maybe even tearful, those kinds of things. It can also be irritability, frustration, and anger. I find in children and adolescents, young adults, sometimes in adults, but primarily the children age group tend to present more as irritable or frustrated or angry. Sometimes parents will say, I barely say anything to her and she's just snapping at me, or the least little thing just makes him angry. So this is a presentation I see a lot with kids. And sometimes they can't identify like the sadness piece, although I think that piece is generally there, but they can identify these other emotions. Another symptom is that loss of interest in activities that they like to do. You're like, well, you haven't gone out and played with your friends today. I just don't feel like it. Or for the teen, well, you didn't go to the dance or the ball game or something. And again, They just kind of don't have the desire to do that when they're feeling depressed. Although, again, in kids, a lot of times, they will still be doing some of their same activities. So it's really hard as a parent to identify that they're struggling with depression. You see some things, but they're still playing baseball, or they're still going with friends or doing family activities. So sometimes that's hard to identify. So just kind of keep that in mind. There can also be appetite changes. So they don't feel hungry, they don't want to eat. You're like, come on, you need to eat. And it's like, no, I'm just not hungry. And literally they don't feel hungry. It also can be maybe eating a little bit too much, or trying to fill up, or try to feel better, if you will. They're not maybe sure on what's really going on with them. So they may be eating more than they would normally eat. And sometimes for parents are like, gosh, why are you eating so much? So just remember that can also be an indicator for someone that's suffering with depression. Also, they can have difficulty making decisions. Things that maybe they normally were able to just, yeah, I'll do that, or no, I don't want to. They have a hard time making those decisions. It becomes very difficult for them. They also can have a lack of focus. This is on down the line, but this decision-making, lack of focus stuff can go together. And oftentimes, people think maybe the child or teen is having some ADHD issues. They can't focus, they can't concentrate, they can't make decisions. I have parents bring their children to see me because the teachers at school have identified, they're just not able to focus and concentrate anymore, or they're staring out the window or putting their head down on the desk. So they're thinking they need to get assessed for, attention deficit hyperactivity disorder kind of a thing, when maybe it really is just depression. There can be sleep issues. So they could have insomnia, where they're not sleeping, or where they can't sleep. They try to sleep, they can't fall asleep. Maybe they fall asleep, but they wake up a bunch in the night. They're just having difficulty with getting sleep. They can also have what we call hypersomnia. You're like, why is that kid sleeping all the time, right? They're taking a nap after school, they go to bed early. What kid wants to go to bed early? Now for teenagers, it's a little different. Adolescents, you require the most sleep other than infancy when you're an adolescent. So your adolescents do sleep more, 9, 10, 11 hours, a night. So sometimes that can be a little confusing for parents too. But another piece to that is when they're not sleeping well or sleeping too much, either one, they're tired all the time. Low energy. Oh, you just slept 10 hours. Why are you so tired today? You're yawning all the time. They're just not sleeping well. So that's another symptom of depression. Also, how they talk can change, what sounds funny, but sometimes they get real quiet. It's like it takes all their energy to get out what they're trying to say. Sometimes they may even speak quickly, which seems strange too. They just want to get it out and get it over with. So there can be some changes there. So kind of be keyed into that a little bit. Certainly if someone's suffering from depression, they can feel worthless or guilty. Some of the guilt that, they've told me, like, I just feel bad. I don't want to go with the family. I don't want to go out there and watch TV or play a game with them. I just want to be alone in my room. So they start to feel guilty because they're pulling away from their family or even their friends. And then they can have feelings of worthlessness. Like, what's wrong with me? I mean, I have a nice family. I have friends. I have, all I need type of thing. And yet they feel like, what's wrong with me? That it just must be me. Something's wrong with me. I'm worthless. It also can have impact on physiological things, right? Little kids will get tummy aches and they don't feel good. Maybe they have headaches, and it could go through all the ages, of children and adolescents, that they don't feel good. Maybe they just got body aches. There's all kinds of things. So you have to remember, as people, we're our body, our physical self, we're our mental, emotional self, and we're also a spiritual self. So we're integrated, right? So if any of those things are off whack at any level, it affects all areas. So it's important to kind of keep an eye on that as well. The other thing is, kids can do things to harm themselves. Little kids might hit themselves when they're upset, angry. They might pull their hair. Even small children will bite themselves, scratch. People will scratch and even cut. And usually those things aren't related to wanting to kill themselves. They're just trying to find some way to find relief from what they're experiencing. And then, of course, suicidal thoughts or ideations, as we call them, or not wanting to live. And I would encourage you to not think those are a ploy to get attention. It really is something we have to take seriously. Sometimes kids don't know. They'll say things like, I hate my life and I wish I was dead, because they just don't have any way to understand or deal with what's going on. So these are some of the primary symptoms that you may see. You may see one or all or a combination of any of them. So what are the statistics, I guess, about depression and among young people? So 2.7 million children suffer from depression. That's a lot, right? Also, adolescents from age 12 to 17 have the highest rate of major depressive episodes at 14%, meaning as opposed to children or adults or seniors. Severe depression among college students, so we're talking people 17 to 21-ish, so young adult, teen, young adult, severe depression rose from 9% to 21% in a 5-year span, 2013 to 2018. That's significant. Right now, the statistics about COVID and all that's happening with that and the increase in depression and anxiety and suicidal ideation, I don't even think we're close to getting the numbers yet, but I am seeing in my practice many, many children, again, young kids, elementary age, and adolescents that are really struggling with these things post-COVID. I don't ask that, I just see where they go with that. And then, when COVID hit and school went online and didn't get to see my friends, all of those kinds of things. So we don't know the impact yet of what the pandemic has how it's affected our children, our society. So let's talk about some of the common risk factors. One of them is biochemical. What does that mean? So as far as depression goes, we have neurotransmitters in our brain. So these are chemicals. We're made up of a bunch of chemicals anyway, our who we are, our bodies and all. But there's serotonin, norepinephrine, and dopamine. And these neurotransmitters affect our mental health. So the biochemical piece, serotonin is often associated with depression. So if that is not functioning properly in our brain, then we can experience depression. Another risk factor is genetic. So it runs in families, if you will. So maybe grandpa was really depressed and mom struggles with depression, or I have an aunt on my dad's side, or you begin to see how this impacts families, kind of a genetic component. There's always this, conversation, is it a nurture or nature, right? So is it genetic or is it the family you're raised in? And the answer is always going to be yes, because it's some of both. Another risk factor is personality. Again, not a character flaw, but we all have different personalities. We're all different people. Some people are a little more of the cup half full, and others are a little more pensive, cup half empty people. Those folks tend to struggle more with depression than those that tend to be more on that cup half full, right? So they have a little more struggle with stress and depression and those kinds of things. And then environmental is huge, and there's been many, many long-term studies related to things like trauma, abuse, neglect, and poverty. Folks that fall into these categories have a much higher rate of depression than those that don't have those kind of issues or socioeconomic kinds of things happening. So there's many factors. And a person may have multiple things, right? There's the biochemical part, perhaps it's in the family, as well as, there are personality type of things and environmental. So there's many things that can develop, depression in someone. But there's really good news. Depression is treatable, right? So if we put the stigmas aside and those things that aren't true, then we can, when you seek out the treatment, it's treatable. 80 to 90% of people respond to treatment. That's a high percentage. And even at that, amongst all people, they gain some relief from their depressive symptoms through treatment. Okay, so it's huge, huge. We're not adverse to going to treatment for cancer, for blood pressure, for diabetes, for anything, but people have a hard time going for treatment for mental health issues, which is really sad and a disparity, really. One of the things I love about being at Ponderosa Pediatrics is that they're integrating the medical piece, right, with their pediatricians and pediatric nurse practitioners, and now they're integrating psychiatry with that. So when the kid, adolescent, whomever comes, the provider identifies maybe some depression or some other mental health things, and they can refer right to the myself and the psychiatrist that's there, either one, and we're able to see and really do that full assessment, which is what the next highlight says. It says you need to get a diagnostic evaluation by a medical professional, again, psychiatrist or a psychiatric nurse practitioner like myself. They can screen at the pediatrician screen. They have little questionnaires they ask each time people come in to see if there's some depressive symptoms or things like that. And they can, again, refer as needed at that point. And the kids get to come to the same place they're used to coming. And they like their providers generally and that kind of thing. The evaluations entail a bunch of things. So it's usually about an hour to an hour and a half long, and I generally meet one-to-one with the child. I introduce myself to the family or whoever brought them, but I meet one-on-one with them because it's really important for me to hear from their side. As a mom, I know when my kids are getting asked questions, I would tend to answer, and it's really important for the provider to be able to hear what the kid's feeling and how they're able to articulate that. Then spend time with the parent, whoever brought them or both, sometimes both come, and able to ask what their concerns are, what they've seen in their child, and what they've seen happening over time. Also can be a physical exam. We often do blood work, so if they're, which kids don't love, by the way, but if they're, say they have some thyroid issues, that can cause depression. Low vitamin D can cause depression and anxiety. There's a number of different physiological things. Again, did these things happen because they're depressed or did they cause the depression? Not always 100% sure, but we need to treat that as well. So one of the ways, that psychiatrists, psychiatric nurse practitioners like myself are able to treat is with antidepressants. And that always makes people like, oh, right? Oh, not that. People get very worried and upset about that. But these are designed to balance the chemical, like we talked about, the neurotransmitters in the brain. It's to help balance those again. They also take some time to work in the body to start, could take a few weeks even. So during that time, I see them often because it's important to get eyes on and make sure they're doing okay. So as I stated earlier, it's very important. It's equally as important as taking your blood pressure medicines or your diabetic medications or any other number of medications that you may be taking for a physiological issue. Because remember, depression is a medical issue. So it's important to do that. Not every single person I see needs antidepressant medications, but those suffering from severe depression, moderate to severe depression, probably could be really helped with that. I'll tell you what they're not. They're not habit forming. You're not going to get hooked on the antidepressants. They're not uppers, they're not sedatives, they're not tranquilizers, none of those things. They're also not a placebo. We're not just giving a sugar pill and then you're going to feel better because, right, it's a behavior you can change. It's not. So I've had people tell me over the years, well, what if I don't believe it's going to work? I'm like, but it will still work. Even if you don't believe it's going to work, you'll be surprised. And a lot of times, being able to get a kid's buy-in, particularly adolescents, is I'm like, look, you've got nothing to lose. You've been suffering for X amount of time from this. This is how long they take. Let's work together, see where we get, and give me a month, give it a month. And they're usually willing because they really are in a place that they're just not feeling very well. And the other thing people worry about a lot is they have to be in it forever. Look, Grandma's been on Prozac for 40 years, okay? Well, whatever, I don't know what grandma's issue is. But honestly, it's not necessarily something forever. Generally, when depression goes into remission, with the treatment, we're going to talk about the therapy component too, but goes into remission with treatment. It's about a year, 18 months, depending on the age of the person. Then they can work with their provider. We can take them off and see how they do. Because sometimes the brain's like, oh, that's what I'm supposed to be doing. And it begins to do what it needs to do with the neurotransmitters. So it's not a forever medicine. Therapy. I can't stress therapy enough. It is key for people to get better. There's multiple therapies. It's not laying on the psychiatrist sofa and talking about your childhood or what have you. There are very specific therapies. They generally are time limited. It's different for everybody, how long that time might be. Things like cognitive behavioral therapy. It helps people, children, adolescents, learn how to develop tools and skills, right? How to communicate better, how to catch those negative thoughts, challenge those thoughts, and turn them into really what's true. Okay, I'm worthless, I'm a terrible son. Well, is that true? Well, no, because my parents said this, and I've been doing that, and those kinds of things. So it helps them to develop those. And there's multiple types of these therapies. And for little children, sometimes parents are like, all I did was play. But for smaller children, play therapy is how this gets communicated to them, right? The other thing is parents are always worried when they're in my office and kids are kind of futzing or playing with something, like, oh, be still, be quiet, listen. The reality is kids hear what we're talking about and they hear when I ask questions and they answer. So sometimes when kids are a little occupied, right, they're still listening. So it's important for us to give the kind of therapy that's most helpful for them, finding a connection with the therapist that they click with. And you parents have to be really involved in that as well. Also, having a person in the family that's depressed isn't that person's problem. It affects all of us in the family. It's the whole family's struggle, if you will. So sometimes it may take time with how parents parent. So it may be parents coming or going to therapy on their own as well. Maybe the whole family comes. Maybe there's conflicts with some of the siblings. I'm talking serious, not that normal sibling stuff, that maybe they have to learn how to communicate better or get through some of that as well. So how can you be supportive? Listen to the person. I'm not talking about listening with, well, I've got this answer. I mean, really hear what they have to say. It's very important to them. Also, don't give advice. Well, if you do this, if you do that, well, I knew a friend, or maybe if you got up earlier, all of those kinds of advice, that's not going to be helpful. Actually, it just causes more worthless feelings and guilt feelings. So leave the advice to the professionals. I'm not saying you can't encourage, because that's the next thing. Offer encouragement. Hey, how can I help you? What is it you need from me as your mom or your dad or your sister or whatever, your aunt? Try to encourage them. And be present. Present means I'm listening to you, I'm talking to you, I'm hearing you. That's what being present is. I'm alongside of you. How can I help you? I love the slide because it really does show that, coming alongside the person. So important. So some key takeaways from this presentation. Depression can happen to anyone. Any one of us can suffer from depression at any given time. We don't know. Many factors contribute to depression. It's not just necessarily one thing or one incident. And I can tell you, most of the time, when I'm taking care of people with depression, they cannot identify a one. It was this that happened. It was that happened. Once in a while, but I would say probably 80% of the time, that's not the case. They really can't identify specifically. Sometimes as they're working in therapy, then they might begin to connect some dots, but initially they really don't know a lot of times what started it. And again, treatable. It can be helped. We can help. And again, always seek professional help. Take your child seriously, or take the warning signs you're seeing, whether it's failing in school, isolating, all those things that we talked about is very important. Let's take some questions now. So trying to figure out what or how, like we talked about a little bit already, my child is depressed. Is it something that's happened, like we talked about biologically, or is it a situation that happened? And again, the answer is yes. So let's say it's a situation that's happened. Someone passed away, maybe grandpa passed away, or someone they're close to. Maybe you've made a big move from another state, or the kids changed schools, whatever. So that's a situation. Either way, if a situation precipitated the depression, generally what happens, that biochemical piece is going to kick in. Okay, or the biochemical piece happens and the depression happens. So it can be either one of those things. So you don't have to decide, well, which is it? How do I know? Again, medical professional, psychiatrist, psychiatric nurse practitioner, providing an evaluation for your child, being able to really glean out what is going on. And it doesn't matter whether it's chemical or situational, we treat it, whatever that looks like for that particular individual. So obviously what's really hard for parents, and I have 6 kids, so I've raised a bunch. What's really hard for them to be able to decide, particularly as you come into middle school, pre-adolescence, into adolescence, is their moodiness just related to all that hormone stuff going on? Or are they really struggling with depression? What's going on? And how do I figure that out? So again, the answer would probably be yes. It's maybe both, right? There definitely is a lot of hormonal changes going on, and those do affect how we feel. Any of us think back to those times. They weren't the easiest times, mostly. Still, those struggles happen. So trying to figure that out, again, if you have concerns that your child, preteen, teen, is having some depression, it's okay to either make an appointment with a mental health professional like myself or a psychiatrist, or even with their primary physician or pediatrician like we talked about earlier, who can do some screening tools, who maybe knows the child pretty well because maybe they've seen them since they were an infant or a youngster, so they would be able to know some of that as well and make the appropriate referral. But if you're concerned, you're like, man, I'm really concerned, I think it's something a little more than maybe just the adolescent stuff, make an appointment with a mental health provider and be able to let them decide. It's better to check it out than to not, right? We don't want them suffering. As parents, we want our kids to be as happy and healthy as they possibly can be. So there will be, in this article that accompany the video, there will be specific resources that would be great to help you with depression and any other mental health things as well that you may want to look up or check out. I would really encourage you not to just Google depression and get all kinds of stuff, who knows what, but stick with the resources that have been researched and are evidence-based. It might be difficult to talk to your kid about, well, we're going to go see Susan Cosgrove at Ponderosa, which might be okay because it's Ponderosa, but they're like, okay, what are we doing? I've been seeing, Dr. Hinton since I was a baby or something like that. So you want to explain to them, hopefully you've already had this conversation with them, that either you're concerned or, I feel like maybe you've been struggling with some things and you've had some conversations about that. Or even if you've taken them to see their pediatric provider there and they do some screening and all of you have a conversation about that. But letting them know that this is just, they're going to talk with you. It's basically pretty low key. A lot of times, one of the first questions, once I have the parents wait out front for a bit, is I say, so what brings you here? Why did you come to see me? And oftentimes the kids are like, I don't know, my mom brought me or my dad brought me. And then after we get going, they begin to realize, and they really do kind of put their guard down a little bit and they begin to express what's going on. I try to keep things very almost matter of fact when I ask questions so that they're not feeling threatened or judged, right? So I ask questions about depression. So do you feel sad? Are you struggling with anger or irritability, or do you just want to rip someone's face off on the littlest things? They can start to relate. And pretty soon they're talking about those things and thinking about those things. So when you have that conversation with your child, hopefully you've had the conversation that you have some concerns and you just want to get them help. And it's cool because the help is at Ponderosa where they're used to being. And hopefully that's helpful for them. So I want to thank you for spending this time listening about depression, and I hope it was helpful for your family.